Good morning. You are here for a cranial nerve exam, I see. Great. I'm Dr. K. It's so nice to meet you. Have you had a cranial nerve examination before? Okay. Well, just a reminder, it's a neurological exam that tests your nervous system. So your nervous system consists of your brain and spinal cord nerves. So I'll be testing your sense of smell, taste, touch, hearing, and vision. I'll be using some different tools and techniques that I have, but nothing will cause any pain, and a cranial nerve examination can actually be very relaxing. Okay, so I have your name here. Can you just please confirm your date of birth? Okay. And who is your referring doctor? Okay. And why were you referred again? Okay, so just precautionary. And when did the accident happen? Okay. Well, I'm glad everything's okay. So, just a few questions. Have you had any headaches since the accident? Blurry vision? Fatigue? Okay. And what about numbness or any tingling sensations in your body? Okay. Any fever? Alright. And then any weakness in your body? Any medical issues in the past? Okay, and when was that? Okay. And then any surgeries? And was that around the same time? Okay. Good. Now, currently, are you taking any medications daily? And how long have you been taking that? Okay. And that's it? And how many hours do you sleep a night? Good. So overall, you would say you've been in good health recently? Okay. Perfect. So first I'm just going to place this thermometer under your tongue for your temperature. So just place that under, please. And then let's just give it a moment. Okay. So, let's see. Normal. And you said you haven't been sick recently, and you feel fine right now, so that's expected. And now I'm going to listen to your heart. So if you don't mind, I'll just be placing this on your chest. Okay. deep breath for me. Very good. And another one. Good. And another one. Good. And another one. Good. Another one. Good. And one more. Good. Your heartbeat sounds excellent. And you don't have any chest pain or any cardiac issues? What about in your family? Alright. So next I will be testing your sense of smell. So this is pretty simple. All I'll be doing is putting a scent under your nose, and you'll just have to let me know what the scent is. Okay? So let me get my scents and then we will get started. So here is the first one. Okay, just going to stick this under your nose. And can you tell me what that scent is? Very good. It is peppermint. I'm going to get another one here. And same thing. Can you tell me what this scent is? Yes. Very good. It is cherries. And one more, alright? Here we go. And what is this scent? Perfect. Very good. It is bubblegum. So next I'll be testing your visual acuity. So I will cover one eye at a time for you. And then I just need you to read for me the lowest line on this chart, okay? And if you can't read it, it's okay. Just let me know. So I'm going to cover this eye first. And can you read the lowest line for me? And then what about the one directly above it? Good. Good. Let's do the other eye. So same thing. So lowest line for me. Good. And now the one above it. Good. Okay. And Can you cover one eye by yourself now? Perfect. And can you tell me what circle is bigger? So let me point. This one or this one? Good. This one or this one? Good. This one or this one? Good. Very good. So a few more things with your vision. Next, I just need you to look directly at me. Very good. And just keep looking at me. Just seeing how your pupils are reacting to the light. Now follow this pen light as I move it towards you. Good. Just keep your eyes on the light. Good. And I'm going to just turn the lights down a little bit lower and have you follow the light again. Okay? So just follow it for me. Good. Very good. Okay. And just keep following. And one more. Okay. Now, with this color blindness book, I'd like for you to just tell me what number you see in the picture. Okay? So here is the first one. Very good. And here is the second one. Good. And here is the third one. Wonderful. And have you had any color blindness issues in the past? Perfect. I just always like to check, just to be precautionary, so especially since you wear glasses and I know you've had vision issues in the past, so I just put my gloves on for the remainder of the exam since I will be touching your face next. But before we do that, just one more eye test. Can you just tell me which fingers are moving? My left fingers or my right fingers? Okay. So here we go. Good. 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 So everything with your vision seems normal. So now I'd like to move on to your sensory nerve tests. So this will be for your face. I'm just going to gently place it on different areas of your face. And I'm going to have you keep your eyes closed for me. Is that okay? Good. And just tell me when you feel it, okay? And you can just say yes. So let's begin. Good. 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 And now the similar thing, except I'm just going to gently touch your face. Okay? So, good. 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 Okay. And did you feel every single touch in the same way, or were some stronger than others? Okay, very good. You're doing a wonderful job so far. Now I'd like to just test your facial nerves. So first, can you raise your eyebrows for me? Very good. Now close your eyes very tightly and squeeze them shut. Perfect. Now smile for me. Good. And now frown. Good. And can you puff your cheeks out? Good. Good, good, good. So let's move on to the brief hearing test. The first thing I'll do is just insert a few drops in your ears, if that's okay. Good. I'm just going to briefly clean them so they're nice and clean for your hearing test, which is simple. It's just one thing. So don't be nervous. And you've had no hearing issues in the past, right? Okay. So I'll start with your left ear first. Just put some drops in your ear. Just gonna gently clean. Can you just stay still for me and tilt your head a little bit? Good. And when is the last time you had your ears cleaned? Okay. So not too long ago. Yeah, they do look very clean, so let's just get this one. Okay. Tilt your head again this one. Okay, very good. Just gonna have a quick look. Okay, looks good. And let's check this one. No pain in your ears currently. History of ear infection? No. Okay. Now I'll just have you close your eyes for me. And I'm going to whisper some numbers. And I just need you to repeat them back to me. Okay. Alright, here we go. 2, 15, 45. Good. 19, 15, 63. Good. 70, 18, 7. Good. 99, 61, 50. Good. And just one more. 10, 23, 66. Very, very good. And did you have any trouble hearing any of those numbers? You heard everything clearly? Alright, good. Just a reminder to get your ears checked about once a year. And especially go to the doctor if you have ear pain or you just feel like your hearing is getting a little bit abnormal compared to usual. Now, just a few things with your mouth. So can you please stick out your tongue for me? Very good. Can you lift your tongue up? Good. Now side to side. Okay. Good. Can you say ah for me and open wide? Good. Can you cough for me? Good. Okay. Now, can you shrug your shoulders for me? Up and down. Good. And I'm just going to put some pressure on your shoulders. Can you resist it for me? Very good. And can you put your arms out straight? And I'm just going to try to push down your hands. And I need you to resist it. Okay? So, right now, resist it. Very good. Now reverse it. I'm going to push up. Very good. Now can you turn your head side to side for me? Just going to see how it moves. Any pain, soreness. Okay, good. Okay. Very good. the last thing I'm going to do is just feel your neck and lymph nodes. Make sure everything feels good and no pain. Okay. Okay. Very good. Well, your brief cranial nerve exam is completed. And like I said, I found nothing abnormal with your cranial nerves. So I think that everything that occurred in the accident did not affect your health besides that broken wrist that you had. Okay? So your nerves are good. Again, we checked your hearing, your vision, your smell, your facial sensation, and those were all good. So I will be sending the results of this exam to your doctor. Okay, and if there's anything you need from me, you can just give me a call. But thank you for coming in. And like I said, your doctor will have these results immediately. So you can follow up with him also if you have any questions pertaining to the results or any concerns. But like I said, everything is normal. So thank you for coming in for this cranial nerve exam today. And take care.